Every year we are remembering more than 50,000 people in the UK that die each year as a result of work. And on top of that this year, because of this government's policies, because of employers' negligence, then we've got thousands more that are going to die as a result of what their experiences of PPE, the use of PPE, etc. in workplaces. But also on top of that, 650 or so that die each year because of suicide, because of the way they're treated in work, and because of exposures to substances and chemicals. So things like asbestos, for example, kills thousands of people each year. That's a result of employers placing profits before people.
Hi, I'm a nurse and I am upset, angry, very, very angry at seeing the amount of my colleagues becoming unwell. But what I'm also concerned about is the emotional toll for staff who are looking after patients and colleagues as well. Because nurses and doctors, we never burn out physically, we burn out emotionally. And when you've got no emotion left, that's when you burn out. And I think the psychological effects of this is going to be for a long, long time. We have got 100 plus healthcare workers that have died. That's not just healthcare workers, that's whole families that have been affected. You can put it into hundreds and thousands. And for those people and for the people in hospitals, I'm looking at cleaners and nurses and doctors, and looking at bin men, and all of us, we're all part of the human race. We should all have proper protection. We should have universal protection for everyone.
Workers' Memorial Day has always been an important day in the workers' movement. We always have to commemorate those workers who have died and fight for the living, fight to create the circumstances where people don't need to die. But this year has a particular significance. Over 100 health and social care workers have already died in the front line against COVID-19. In London, more than 20 transport workers have lost their lives. Here in Tower Hamlets, we just found our first loss, Yusuf Ali, a transport driver who drove children with special needs to school. Dave Last, a handy person at Chris Street Health Centre. Donald Suelto, a cancer nurse who lived in Bethnal Green. These are the losses that we're all facing. So Workers' Memorial Day has to be a day when we commemorate all of those key workers who lost their lives, but it has to be something more. It has to be the day that we fight for the living and that we fight for the conditions that make working with COVID as safe as it can possibly be. We need PPE now for all workers as appropriate, not just our frontline hospital workers, but our care, our social care workers, and all those workers who continue to provide essential services for the public. The testing has to be more than a promise, it has to be turned into reality. And we have to make sure that before there's any attempt to rush people back to work, there is full consultation about the means of making work safe. We have to keep all of us safe because these are the essential workers we rely on to keep all our communities safe. Let's make Workers' Memorial Day a day that speaks for the dead and fights for the living.
You've got to look at the history of people in effect dying at work. People were just in effect murdered at work. There wasn't even a post-mortem or anything. It's important, we believe, to keep it on the agenda that people are still dying at work due to accidents, due to negligence mainly by employers, and of course people made ill by work. We've got lots of people now who are disabled. We think it's so important that Workers' Memorial Day is commemorated. This year is probably the most poignant time we could hold an International Workers' Memorial Day commemoration because of what's happened.